Blumenthal, I know you've only been there a short period of time and didn't have any input into the language of the bill, but why would 13 members of this HIT policy committee be appointed by the Comptroller General?
Sir, I really can't get into the minds of the folks who wrote this legislation. So
No, I can't either. I don't know of anybody in this room that could, really. But, you know, I guess the interesting part is just the makeup of this board and, you know, and exactly what's going on. But each state, I'm assuming, is going to get some money to help them communicate with these health records also. Is that right?
that's correct. That would be, the Congress actually directed us, the Appropriations Committee directed us to spend $300 million on, at least $300 million on grants to states to encourage health information exchange.
Okay. And then the $44,000 that will go to the physicians or the healthcare providers, when do you see that money, how long do you think it's going to take to get the program started?
Well, those monies, the first monies become available in 2011. So we are devoting ourselves to laying the groundwork so as many physicians and hospitals as possible can be eligible for those funds in 2011.
In your department will be the one administering that. They will actually apply to your department.
They actually will apply to the Center for Medicare and Medicaid Services because they will be eligible for bonuses in Medicare or Medicaid funding, and that is the authority of the Medicare and Medicaid programs rather than my office, which is devoted to developing policy and programs around health information technology. We don't control the Medicare and Medicaid programs.
And as far as the security goes, you know, we have foreign countries hacking into our grid system and doing things. And, you know, with the new HIPAA requirements and stuff, who is going to be responsible if somebody hacks into this system and people's medical records get out? Because, you know, if somebody drops a chart off of a cart or leaves it laying open in a hospital, that's one person. You hack into a system, you're talking about millions of people. Who is going to bear that responsibility? Is it going to be the doctor? Is it going to be the person that wrote the IT program? Is it going to be the government? Who's going to be responsible for that?
Well, that's an excellent question, and we are very, very committed to making this system as private and secure as possible, and we are exploring ways to increase its privacy and security. The liability for any breaches falls, as I understand it, to the organization that holds the information, and we are going to have a very diverse information system in this country as we have a very diverse healthcare system. So I imagine that it will depend on who is responsible in the particular case for collecting and holding that information. But if you'd like more information on that, I'd be glad to get back to you with a legal opinion.
I mean, your department is going to be responsible for the rules and regs, right? I mean,
we are going to be responsible for some of the rules and regulations. A lot of what we're going to be doing is giving guidance to the states who often develop privacy and security laws. That is in this country.
So
HIPAA puts a floor under this, but the states can supersede HIPAA regulations and create additional regulations, and they often laws and regulations, and they often do.
If they do, then I can see where they could be responsible for the different things. But if they don't, if they just go with the federal government's HIPAA regulations, then who is going to bear the responsibility for these?
Well, Congressman, I would like to get back with you on that because I would like a legal opinion about that.
That's fair enough.
Yeah.
Thank you.
I actually have to apologize, but I have a 1045 obligation on the Senate side. I informed your staff of that as we were preparing for this hearing. So if, with your permission, I will leave a little bit early. If there are other questions that you would like me to answer, I'm sure that we can get back to you in writing.
Well, Dr. Blumenthal, I thank you for being here today, and thank you for your time, and I'm sure you'll be available if anyone on this committee has further questions about this, that we can contact you and your staff.
Certainly.
All right, thank you very much. We have been called for a vote, and it looks like it's going to be one vote. So I think we're going to, we can run over and vote and come right back, and then we will resume the hearing with the second panel when we return from votes.